Okay, hi, this is Ethan Lead from the Facebook group Empower the Body to Fight Cancer Naturally, and I have with me today Monique. I've known Monique, I don't know how long I've known Monique, she'll probably know, but about a year and a half, something like that. And I've been helping Monique with her husband's. She's got a rare bone marrow disease, but one of the products that I recommend is a mineral product, and it provides 75 minerals in a plant-based form. And I've been recommending it for quite a long time now to a lot of people. And I was chatting with Monique, and she's very involved with animals. She's actually a dog groomer and has been a dog groomer since she was a child. She works at a veterinarian's, very, very heavily involved in animals. And while I knew that this mineral product worked with animals, she knows a lot more than I do about it. She was telling me some stuff, and I thought, wow, I'd like to share that information. I asked Monique if she would be happy for me to have a chat with her on video and to record it. She was. So, hi Monique.
Hi, how are you, Ethan?
I'm excellent, and Monique, I'd love it if you'd share some of the information that you shared with me about how plant-based minerals have been used with animals and the kind of results you've personally seen and know about. So the floor's yours, Monique.
Okay, what happened is when I bought these minerals that you recommended, you did mention kind of like not very like important, like, but you said you could also give them to your dogs. So I have three little poodles, and one of my poodles has a disease with her liver. And when she was diagnosed 6 years ago, they had told me that she would not live a long time. But through diet, just like you recommend diet for people, I have made my little dog be 6 years old. But once in a while, she still has a problem. And one of the times I noticed that she was licking the walls and licking the furniture and licking everything in her sight, like she needed something.
Okay.
And so I went to the veterinarian and I asked the veterinarian what could be lagging on this dog. And she said, sometimes they need vitamins. And
Monique,
while
can I
I
just
was
pause you?
talking to the veterinarian,
Monique, can I pause you to a minute? Your camera's moving. The camera's now moved. So there we go. There we go. Your face was slowly sliding off the page. So
okay.
that's better. So sorry, Monique. Carry on.
So anyway, so the veterinarian was with also the technician, and this lady tells me, said, we get a lot of dogs here that customers will say, my dog just ate dirt. And so my light bulb went on, and I said, wait a minute, Ethan told me that I can give minerals to my dogs. And I thought if a dog is eating dirt, it's because a dog needs whatever is inside the dirt. I don't know what's inside the dirt.
Not vitamins, that's for sure.
What Ethan is telling us to buy, it's a plant-based mineral. And of course, plants grow in dirt. And so dirt must be given these plants the minerals we need for our bodies. So I came home that evening and I started sprinkling for about a week every day a little bit of these essential minerals that I bought from Ethan.
Can you show us the bottle? Can you show the bottle, Manny? I know you've got.
Yeah, the bottle.
Okay, so this product, now I normally recommend its partner, which is a sizzling minerals, and you put that in water and you drink it, but that's not appropriate for a dog. But this one, which can also be used for a human, this one is perfectly great for a dog, and that's the one you've been using, right?
Yes, this is the one I've been using, and it comes with a tap that you can sprinkle, so I can sprinkle a little bit in the food every day.
Right.
And my dog has completely stopped licking walls and floor and furniture and anything. And it actually acts happier. It's not having signs of vomiting anymore.
Okay.
She was probably lacking minerals.
Without question, Sorry.
Go ahead.
But one of the things that your dog was doing is quite common among pregnant women. They usually don't lick the floor, but they do get cravings, and sometimes they're chewing on coal or weird stuff. And the reason is that intuitively they're lacking in minerals, and they're trying to find although there are minerals in dirt, it's not in a form that's very usable by our body, but we can get a bit from it. So that's why your dog was doing it. That's why humans do it when they get these cravings, and it's particularly obvious in pregnant women because pregnant women get particularly low in minerals due to the fact that they're having to give a lot of their nutrients to the baby. So yeah, that's exactly what it is, and it's wonderful your dog stopped doing that.
Yeah, my dog stopped doing that, and I think my dog acts much better since I've been giving her the minerals. And
Right,
they're really not that expensive, and you only need to sprinkle a little bit. I
right.
take them myself, the same kind, the same thing, and it does have kind of a bitter, earthy taste, but it's not bad. The dogs don't mind it, and it works. And the only thing, like I said, that made me think about not maybe she doesn't need vitamins, but maybe she does need a mineral.
Hmm.
And when I started doing that, after Ethan said, give her, the dogs can take that too, I started doing that and I have no more problems.
Awesome. And
So I recommend that for humans and for, you
both of
know,
yeah, we all need
for
minerals.
animals.
So did you tell your vet? Did he have anything to say?
Yes, I did tell my vet, and it said that's fantastic. And she asked me the name of the product, and I don't know if she might recommend it to some of her customers or not. But she told me that actually I'm the only customer with a dog with this condition for her liver, and I'm the only customer that have a dog that can live with this condition for over 6 years. But you know what? I also have a husband that has a bad condition with her bone marrow, and he is doing okay after 20 months of being diagnosed. I also give him, he takes the sizzling because
Right.
he would not like the taste of the other one.
Okay, let's talk about your husband then, since you brought it up. So your husband has got a very rare bone marrow disease. That's right, yes.
Correct, yes.
And he's getting he's been to the best doctors, and basically they didn't give him much hope, right? They fully expected him to be gone long ago, right?
Correct, yes.
Okay, so
Yes.
I've worked with you, and we've put him on the Marry protocol, which is the same protocol pretty much that I use for my wife, and he's on a range of products. And tell me what the doctors are saying about what they're seeing in him, and what their feelings are about that. Tell me about that.
Well, the doctors told him they would like him to have a bone marrow transplant, and he said no to that. He told them he wanted to have a quality life and not a quantity life. So when he was diagnosed, I have a very good friend here in Illinois. Her name is Maureen Smetzer, and she's also one of your clients.
Hmm.
And she told me about you, and she put me in contact with you through getting transfer factor. And
Right,
so when he was diagnosed in March of 2015, I right away contacted you and I started buying transfer factor. And
right,
he's been on transfer factor since. And transfer factor helps the immune system, which is what
right.
he needs because
Absolutely.
his bone marrow is failing. And so when he goes to the doctors, when he goes to the oncologist cannot believe what he sees because he says, there is no human being that can walk around with your hemoglobin of 5. There is no way a human being cannot operate in the way you do. And the only thing that I can think of is transfer factor because that is really the thing that we really, 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 really take every day.
Right,
And started about July of this year, I have doubled his doses because I want him to have a little more help. And today we went to the doctor and his hemoglobin was maintaining at 5.7. Now he gets a blood transfusion every week, but before those blood transfusions wouldn't do anything. Every time they gave him a blood transfusion, his blood levels will fall back to 2 instead of
right,
staying at 5 or 6. Normally we have to have 14. That's normal for everybody, but he can operate on 5 and point 0.7. But we really believe that is the transfer factor. Now, because it is not the traditional medicine that doctors recommend here, no doctor wants to talk about it, but they're willing to listen to our story. And I
right.
bet you that in the back of their mind, they're going to say, whatever, because they always tell me, keep doing what you're doing. Keep doing what you're doing.
Did you,
And
if I'm remembering correctly, did you mention to me that one of the doctors had said something about you might as well throw the medical books away, based on your husband because he just wasn't obeying any of the normal rules that they know and understand. Was it something like that you said?
exactly.
Yeah. Yeah.
Exactly. One of his doctors that he sees, pretty much his general practitioner, when Louis goes there, the doctor said, Louis, when it comes to your disease, we have to throw all our books away because none of them make sense to us. There
Right.
is no there is no way a human being can operate, and with him not having any platelets, he should be bleeding to death. And
Right.
today he dressed up for Halloween
As
like
a
a
vampire.
vampire to go
Yeah.
to the hospital to go get blood.
Yeah. That was
So,
hilarious.
yes, I believe blood is keeping him alive. And I know many people might not believe in blood, but blood is keeping him alive. But
Right.
we truly believe that transfer factor has a lot to do with what's happening.
Absolutely. Because the
I
problem with a
absolutely,
bone.
I
Go
absolutely
on.
believe, I believe that transfer factor is the way to go.
Right. I mean, transfer factor is one of the foundational products in the protocol because it does things for the immune that nothing else can do. It has the ability to transfer information from one immune to the other, and it's actually what is passed from a baby to from a mother to a baby in a colostrum. It's the natural means for which we pass information from one immune to the other. So yeah, it's an unbelievably brilliant product. And what I've found is that a lot of people who are even in desperate straits like your husband get results with transfer factor when nothing else is working, and it warms my heart when I hear stories like yours, and I've had many others where people who the doctors have basically written off, and the transfer factor comes into play, and things start happening that nobody can really explain because they don't study this stuff for the most part. It's not a drug; it's natural. So yeah, it's great to hear that story, Monique, and I'm really
Well, what I like I said, his disease, no human being, no animal can live without blood. Blood is it's your mechanism, it's what makes you live. And my husband has every one of his cells down to nothing. I mean, his
right.
white cell count are 0.06 when they should be at 3. Now,
Yeah,
he has not gotten, in 20 months that he's been diagnosed, he has not gotten a cold or an infection or any of that kind of stuff. And we believe it's transfer factor.
well,
It's the only thing.
according to medical science, if white blood cells are at that level, you basically haven't got an immune system. I mean, he hasn't got a natural immune system. His bone marrow is not able to manufacture the things it needs to do. So the doctor's understanding is correct. Really, he should be dead. He should be, because he should have. It's impossible. Without an immune system, you should be getting absolutely everything. And transfer factor is somehow helping him to be able to resist all these attacks of infections and so on. And of course, the blood transfusions are important in his situation as well. We can't ignore that. But they weren't doing the job on their. That once transfer factor came in, what the blood transfusions were doing improved. Right? They weren't doing as good a job without the transfer factor.
Well, and one thing too is I have to make sure that I am also healthy, because otherwise, if I'm sick, he can get sick.
Right.
And the other day, I was feeling a little sore throat, and I believe a lot. I know that you don't sell this, but I believe a lot in colloidal silver.
Oh,
And
absolutely. I'm a big believer. Yeah.
and Louis also takes colloidal silver. And
Yeah.
like, for example, when he gets a sore, because he gets little sores, I start telling him to put that colloidal silver. The sore is gone in 2 days.
Absolutely.
And my sore was gone, my throat was sore, and I was gone. And then, of course, I also take transfer factor. So,
Well,
I don't take it as often
colloidal
as he does,
silver,
but
colloidal silver is a natural antibiotic, antiviral, antifungal. So that is also going to help your immune, because obviously your immune has to deal with any kind of infection, and colloidal silver is going to come in and help your immune to do that. So for me, colloidal silver is one of my go-tos as well. Sometimes I use iodine in water instead of colloidal silver, depending, but both of them very, very effective. So yeah, I'm a big believer. And if I get a sore throat, I'll gargle with colloidal silver or an iodine solution. And you're right, it takes it out rapid. rapid. So that's awesome.
Exactly, and that's one of the things besides the transfer factor. That's the other thing that we give him. And as a matter of fact, we watched a program on TV, and it was about silver and silver mining. And they were talking about how incredible the power of silver is, because silver is a natural antibiotic which your body will never fight,
Right,
because it's
right,
natural.
right.
And actually, when we were at Mayo Clinic, we did tell one of the doctors that I was giving him silver, and he told me that I was good. He was not
Although you
arguing.
might want to rethink that now he's a vampire, because silver and vampires not a good combination. But
Yeah.
but yeah, I mean, as you know, Manny, I had a tooth pulled not long ago because I refused to have a root canal. It's a tooth that I damaged from a fall, and I didn't have a root canal, and so I had it pulled, and my dentist wanted me to go on antibiotics, and I refused. And what I used was colloidal silver primarily. I also used iodine, and I didn't need the antibiotics. It dealt with it, and it's all healed up fine. And at some point, I'm going to have an implant. But yeah, colloidal silver, amazing stuff. So okay, so before I close it, was there anything else you wanted to say about it, or
No, you have helped me a lot. I mean, you have guided us to the Mari protocol, and also to the items that I have that I bought through you. My husband also takes Sol International too. So he takes a pouch of Sol and 2 capsules a day of transfer factor, and then he takes the sizzling. Yep.
right, now Sol,
And
because now you've mentioned it, I better just cover that. So Sol is a seed nutrition product. It's made up of 3 seeds: black cumin seed, black raspberry seed, grape chardonnay seed, and a 5-carbon sugar called D-ribose. And basically, again, that's helping his immune, because what it does is it's a very powerful anti-inflammatory. In fact, it's 281 times more powerful than aspirin, and aspirin works on fighting pain by dealing with inflammation. And it hasn't got the nasty side effects of aspirin. So it's a very powerful anti-inflammatory. It's also an antioxidant. It also increases oxygen levels. It helps to balance pH and so on. So a lot of the things that are very important for his body, it will be doing. And it also provides a massive dose of nutrition. In fact, 1 pouch provides about the same nutrition as 20 servings of organic fruit and veggies, just in 1 pouch, and it's about $3 for a pouch. So that's I think it's amazing you got all that for so little. Because if you did it with fruit and veg, I don't know how much it would cost for 20 servings, but a lot more than that, I know. So that's and it also it fights cancer stem cells, which is another very, very important thing. So Sol is an amazing product. Can be used topically as well. Have you ever used Sol topically, Monique? Have you ever used it at all for anything topical?
the what?
Have you ever used the Sol topically, on something topically on your
No,
skin? No. Okay. Did you know you could?
I didn't know.
Yeah, no, topically it's fantastic. If you've got any pain, chronic pain is caused by inflammation, and you can literally apply the Sol topically to that, and it's, in some cases, I've seen it work in 2 minutes, less than 2 minutes, with plantar fasciitis, for example, which is a very painful problem in the foot area, and I've seen people apply Sol, and 2 minutes later their pain is gone. It's not usually that fast, but I have seen it that fast. But yeah, no, topical is a brilliant way to use Sol anywhere you've got pain or a tumour or anything like that. So bear that in mind with your Sol. You can use it, but you can't give it your dog. Don't give it your dog. Not good for your dog.
Oh,
But
I know it's
I know
not
you.
good for dogs.
Yeah, I know you know that. Manique, it's been an absolute pleasure. Thank you so much for sharing that information. I'm just going to say bye now. So bye, Manique. Bye, everyone listening. Thanks a lot.
Bye. Thank you.